Living with weakness after a meningioma. Living with weakness after a meningioma can be a challenging experience for many individuals. Even after successful treatments like surgery, weakness may linger. This can be due to the tumor's effects on brain function, the surgical procedure itself, and the overall recovery process. Meningiomas are generally benign tumors that develop from the meninges, the protective membranes surrounding the brain and spinal cord. While many patients can be cured through surgery, they often face ongoing symptoms, including weakness, fatigue, cognitive difficulties, and changes in behavior. One key aspect to understand is the persistence of weakness. Many patients may experience weakness on one side of their body or in specific limbs. This condition, known as hemiparesis, is common, especially if the tumor affected areas of the brain responsible for movement. In some cases, this weakness may improve gradually, but it can last 4 months or even years. Rehabilitation plays a crucial role in recovery. Intensive physical therapy, occupational therapy, and sometimes speech therapy are essential for helping patients regain strength, coordination, and independence. It is not uncommon for patients to feel frustrated due to a loss of independence and the slow pace of recovery. However, consistent therapy has been shown to improve outcomes significantly. Fatigue is another common issue reported by many meningioma survivors. This fatigue can be both physical and mental, often contributing to feelings of weakness and reduced stamina. Cognitive impairments, such as memory problems and difficulty concentrating, frequently accompany physical weakness, making daily tasks more challenging. The emotional and psychological impact of living with weakness should not be overlooked. Symptoms can lead to mood swings, frustration, and feelings of vulnerability. Support through counseling, social networks, and coping strategies, like using visual prompts or structured routines, can be beneficial for emotional recovery. Long-term monitoring is also essential. Regular follow-up care, including neurological exams and imaging, helps track any potential tumor recurrence, which can influence symptoms. The need for ongoing rehabilitation and symptom management will depend on various factors, including the tumor's grade, the completeness of its removal, and individual patient characteristics. In terms of outlook, patients with low-grade meningiomas generally have a favorable prognosis, with high survival rates. However, neurological deficits, including weakness, may persist. Higher-grade tumors carry a greater risk of recurrence and may necessitate additional treatments, which can impact recovery and symptoms. In summary, living with weakness after a meningioma involves managing persistent neurological symptoms through rehabilitation, medical follow-up, and supportive care. While many patients experience gradual improvement, some degree of weakness and fatigue may remain long-term. Ongoing physical and cognitive support is essential to optimize brain health and enhance quality of life. Always consult with healthcare professionals for personalized medical advice tailored to individual needs.